friends, welcome to the channel. So today in this video we are going to cover some questions with their brief explanation. So here we have first question is flash point of an aerosol is determined by options are option A, tag open cup apparatus, that is flash point, B, cascade impactor, C, light scattering decay, and D, all of the above. So the flash point of an aerosol is determined by which apparatus, that is tag open cup apparatus is used to determine the flash point of an aerosol. So let's discuss with the help of explanation that tag open cup apparatus is used to determine the flash point, where this cascade impactor is used for particle size determination, that is where, and another one, light scattering decay, it is used for particle size determination and the range is given 0.1 to 20 gram, and in cascade impactor case 0.2 to 30 gram. So moving on, next question. Chain A and B of insulin are linked by options are option A, amide linkage, option B, disulfide linkage, option C, sulfide linkage, option D, hydrogen linkage. Which linkage is used to link the chain A and chain B of insulin? So the correct answer is disulfide linkage is used to link chain A and chain B of insulin. So let's discuss in detail that first structure of insulin. So insulin is composed of two peptide chain, that is A chain and B chain. A and B chains are linked by two disulfide bonds, and an additional disulfide is formed within the one A chain. In most species, A chain is consist 21 amino acids, where B chain consists 30 amino acid. And talking about the amino acid sequence of insulin varies among species, and certain segments of the molecules are highly conserved, including the position of the three disulfide bonds, both ends of the A chain and C terminal residues of the B chain. So it's all about the insulin. That insulin consists of 51 amino acids, that is divided into two chains, that is A and B chain. A chain consists 21 amino acids, where B chain consists 30 amino acids, and it is linked by disulfide bond. Here we just have a structure of the insulin, that A chain consists 21 amino acid, that is 21 amino acid, where B chain consists 30 amino acid, and it is linked by disulfide bond. It's in a disulfide bond. So it's all about the insulin. So moving on, the next question. Antibody present in highest amount in the body is, and the options are option A, IgM, option B, IgD, option E, IgE, option D, IgG. So which is the antibody is present in highest amount in the body is, so the correct answer is IgG is present in the highest amount of antibody in the body. So let's discuss about their percentage in the body. Here we have a chart that IgG present in the highest amount of the that is 80%, where IgM present 6%, and A present 13%, D present 1%, and IgE present at 0.02. So how to learn this percentage or a series? We can learn that G is just individual word, M, A, D, E. So it words combine made, G made. So G present at highest amount. So it's a trick that made 6, 13, 1.02. So I hope student your doubt is clear regarding the percentage of antibodies in body. So moving on the next question, what is the now known name of the given reaction? So here this is the reaction given and we have to just name this reaction, and the options are option A Gattermann's reaction, option B Sandmeyer's reaction, option C Marvin reaction, and option D Bals-Schiemann reaction. So which is the reaction is given above, and we have to name that reaction. So the correct answer of this reaction is Marvin reaction. What is Marvin reaction? Let's discuss with the help of explanation that benzene diazonium chloride reacts with the compound containing activated double bonds to produce phenylated product. So the reaction is called the Marvin reaction. So students just try to learn that the reactant is benzene diazonium chloride reacts with the compound of containing activated double bonds, and the what will be the product? The product will be the phenylated product. So it's all about the Marvin reaction, Marvin arylation. So moving on the next question, which method provides the precise identification and description of a crystalline substance? So we have to just identify the method. Option A microscopy, option B X-ray crystallography, option C DSC or DTA, and option D NMR. So which method provides the precise identification and description of crystalline substance? We have to name that method. So the correct answer is X-ray crystallography is the method which provides the precise identification and description of crystalline substance. So what is X-ray crystallography? We have to know first. So X-ray crystallography, that it is a technique used for determining the atomic and molecular structure of a crystal, in which the crystalline structure cause a beam of incident X-ray to diffract into many specific direction. How it is possible? We just look in with the help of diagram. First of all, we have to know about that by measuring the angles and intensities of these diffracted beams, which is diffracted by the crystalline substance, a crystallographer can produce a 3D picture of the density of electron within the crystal, and from this electron density the mean position of the atoms, or their actually their structure with the help of mean position of the atoms in the crystal can be determined, as well as their chemical bonds, their crystallographic disorder, and various other information can be observed with the help of this instrument. So it's all about the X-ray crystallography, and how the X-ray crystallography looks like. We just have an explanation with the help of this diagram. So this is the diagram. This is the X-ray source, in which that it is a sample. Suppose an X-ray comes from here and the just goes through the sample, and it is a diffracted rays which is produced by this sample, that is protein sample crystal, and the lights are diffracted in these pattern, and the diffraction pattern can be observed by the crystallographer, that is C, and may leads to the making of 3D model. That is a 3D model we can observe. So it's all about the X-ray crystallography. Moving on the next question, biological indicator for gaseous sterilization is, and the options are option A Bacillus pumilus, option B Bacillus subtilis variety Niger, option C dot sporogenes, option D C dot tetani. So which is the correct answer or biological indicator of gaseous sterilization? So the correct answer is Bacillus subtilis variety Niger. So let's discuss with the help of this table that there are various by indicator or biological indicator with the help and sterilization method. These are the sterilization method, and just give biological indicators. So for dry heat, the brown tube, bow dick heat sensitive tapes, and clostridium sporogens are used in where in moist heat the B. stereothermophilus or Bacillus coagulans are used as biological indicators. In case of gases, that is ethylene oxide, Bacillus subtilis variety Niger or Bacillus subtilis variety Goldbiggi. So the correct answer is Bacillus subtilis variety Niger used in gaseous sterilization. And in case of radiation UV light, the Bacillus pumilus or Bacillus specerius. Students just try to learn these biological indicators with the help of with sterilization methods with their specifications, because it sometimes the question may also arise from this. And talking about the filtration sterilization method, we use as a biological Pseudomonas diminuta and Serratia marescens. The, this all it is all about sterilization method and biological indicators. So moving on the next question, a term which describes a cofactor that is firmly bound to an apoenzyme. So the options are option A, holoenzyme, option B, prosthetic group, option C, coenzyme, option D, transferase. So which is the term which is used to describe a cofactor that is firmly bound to an apoenzyme? So the correct answer is coenzyme is used to describe that. So let's have a discuss with the help of explanation that what is apoenzyme. Apoenzyme is the protein component of an enzyme to which the coenzyme attaches to form an active enzyme. Where what is coenzyme then? A coenzyme is a known protein, where a coenzyme is a protein component and a known protein chemical compound that is bind to an enzyme, and which with loosely bound cofactor termed coenzymes and tightly bound cofactors termed as prosthetic group. And what is transferase then? Transferase are those enzymes which are responsible for transfer of groups, as its name indicate, transferase. So it's all about the information about the apoenzyme, coenzyme and transferase. So moving on the next question, vigabatrin, a newer antileptic, is a options are GABA agonist, GABA transferase inhibitor, option C, an MDA antagonist, and option D, calcium inhibitor. So what is vigabatrin actually? And the vigabatrin is a newer anti-epileptic drug, and it is GABA transferase inhibitor. So we just give a trick to learn about this, that what is how we can learn about the vigabatrin. Vigabatrin as it is an inhibitor of GABA transferase, the enzyme which degrades GABA, and anticonvulsant action may be due to increase in synaptic GABA concentration, and it is effective in many patients with refractory epilepsy CPS with or without generalization. It is approved for adjuvant medication, visual field contraction and production of behavioral changes and depression. So its main defect is visual field, means visual defect. So if the question may ask that what is the major adverse effect of the vigabatrin, as its name indicate, viga, vi starting from the vi, so it leads to the visual defect. Students just try to learn with the help of these tricks, and behavioral changes also occur with this drug. So we can explain with the help of this table, that here just vigabatrin inhibit the GABA transferase, vigabatrin. So there are three mechanism of action, that three methods, that prolongation of sodium channel inactivation, facilitation of GABA mediated chloride channel opening and inhibition of T-type calcium current. So these are the drugs which are given with in these conditions to help in these conditions. So you have to learn these. So it's all about the vigabatrin. That vigabatrin actually inhibits the facilitation of leads to the facilitation of GABA mediated chloride channel opening. So how it happened that vigabatrin actually inhibits the GABA transferase inhibitor, which help to GABA initiate that it leads to the chloride channel opening. So this is all about the vigabatrin. Moving on the next question. Lucas reagent is option A is ZnSCl, option B is FeCl3, option C is BaSO4, and option D is none of the above. So which is the Lucas reagent? And the correct answer is ZnCl. Lucas reagent is ZnCl. So let's have a discussion about this, that Lucas reagent is a solution of anhydrous zinc chloride in concentrated HCl. This solution is used to classify alcohols of low molecular weight. So just try to write down that what actually Lucas reagent does. So the reaction is a substitution in which the chloride replaces a hydroxyl group. So it's all about the Lucas reagent, and the correct answer is ZnSCl. So next question is about acidic drug, which statement is true? So options are best absorbed in acidic medium, best absorbed in alkaline medium, not absorbed in acidic medium, and bind to alpha glycoprotein. So what statement is true about acidic drug? So the true statement is about acidic drug is best absorbed in acidic medium. How it will happen? We can explain with the help of this, that when a weak acid is given orally, most of the drug in the stomach is unionized. That most of the drug, students just try to learn that most of the drug are present in unionized form and favoring diffusion through the gastric mucosa. So theoretically, weakly acidic drugs like aspirin is a weakly acidic drugs are more readily absorbed from an acid medium. So the correct answer is that what will be the correct answer of our acidic drug, that it is absorbed good in acidic medium. So it's all about this video. Thank you.